ADHD, or Attention Deficit Hyperactivity Disorder, is an innate attention deficit disorder. Children who have ADHD often have problems with paying attention for an extended period of time. They are often unable to focus long on a command to work. However, when they are interested, they can keep focused. They tend to move continuously and are known to be impulsive, not thinking before doing something. Although ADHD is often diagnosed and is said to occur in children more frequently, adults also have the tendency to suffer from the disorder. The exact cause of ADHD is unknown, but there are 3 factors related to its occurrence. They are heredity. Children with a parent with ADD or ADHD have an increased chance of getting ADD or ADHD too. A neurobiological disorder in the brain that is caused by chemical imbalances inside the brain with neurotransmitters, and environmental influences. ADHD seems to be more commonly diagnosed nowadays because society generally is ADHD unfriendly. ADHD is often thought to be the same as ADD, or Attention Deficit Disorder. Although both ADD and ADHD are an attention deficit disorder, it is not exactly the same, and ADD is a subtype of ADHD. People with ADHD are known to show hyperactivity and impulsivity, while somebody with ADD has a predominantly inattentive behavior. People with ADD have little or no symptoms of hyperactivity and impulsivity, and with predominant complaints of inattention, easy distractibility, disorganization, procrastination, and forgetfulness. People with ADD are also likely to accept and internalize the continuous negative feedback, creating a great tendency for low self-esteem, and will often lead to the development of secondary psychological problems that includes anxiety disorders, sexual and mood disorders, and substance abuse. Generally, symptoms of ADHD are inattention, hyperactivity, and impulsivity, mental high sensitivity, chronic forgetfulness, anxiety, low self-esteem, anger management issues, an increased risk of addiction, smoking, drugs, alcohol, and gambling addiction, procrastination, mood swings, depression. Symptoms of ADHD may decrease with increasing age. ADHD may also entail positive qualities such as a high social intelligence, a great empathy and sensitivity, exceptional ability to see certain things in detail. They are often very caring towards others, and they often excel in talent in a certain field, such as music. There is no cure for ADHD. However, treatment can help a person feel less affected by the symptoms of ADHD. The symptoms of ADHD can be controlled by medication, behavioral management therapy, and involvement of parents and teachers. Medications called stimulants are used to control hyperactivity, impulsivity, and to increase attention span. Some commonly used stimulants for ADHD are methylphenidate and dexamphetamine. Non-stimulants are also a medication option for ADHD, like atomoxetine. Guidance includes treatment modalities that focus on behavior modification, counseling, special education, and social skills training. For more information about ADHD and possible treatments, you should contact your general practitioner.
Hello and welcome to this short version of Autism and the Brain-Body Connection. This workshop is an hour-long workshop, but in the interest of individuals being able to view it more readily, I've created this shorter version. And my name is Dr. Steve Tullius. I am a pediatric and family chiropractor. I lecture internationally on health and well-being, and specifically on chiropractic and pediatrics. This information is about results. We're seeing tremendous results in our office as well as other offices throughout the world, and we want to share that with you so you can make the best decision when it comes to your child's health care. The nervous system your brain processes 11 trillion bits of information every second. It's like a huge sponge just taking in information from the environment, and it does so through the spinal cord and all the nerve endings that come off of that spinal cord. You know, the information in our environment doesn't change, but how we respond to and how we are able to interpret that information does. And so that's what we're really going to talk about here. This is your nervous system, your brain, your spinal cord, and then all the nerves coming off your spinal cord and is housed and protected by your spinal column and your vertebrae. That's the main function of the spinal column there. This graphic represents how information comes into the brain and how a healthy response comes about. On the left, where we have our senses, all the information coming in through the various senses, and then into the brain, and then there should be a healthy output, a healthy response, and a healthy adaptation to what's going on in the environment. And so in this equation, researchers are primarily looking at the brain as the problem. They're saying that the autistic brain is different, and that this is why the response is different. And while that is true to some degree, they're not looking at how, is the information coming in properly? Is the brain able to respond to that information appropriately? This is how an example of how information comes into the nervous system. It's a normal reflex. We've all had this done before at some point. Doctor hits your knee with a little hammer there. Information goes into your nervous system, and your nervous system produces a response, and that's a way to look at how healthy is the nervous system. This is a diagram of the autonomic nervous system, and it's like the automatic system because it controls all the activities of your body, your organs, your heart rate, blood pressure, digestion, all those things, so that we don't have to think about it. This is a diagram looking at sensory integration. It basically happens in 3 steps. Information comes in through the sensory receptors, through the eyes, the ears, and especially your proprioceptive system. This is a system that very few people really talk about, and it's made up of nerve endings that relay information about the environment. When you touch something, when you feel textures, that sort of thing. Coordination is all controlled by this, so information comes in through these various areas, especially the spine, and that information goes up into the brainstem. It's processed and then goes over to the cerebellum, where a lot of that information is then distributed to other parts of the brain, where the brain can respond and act appropriately based on the information. So where's that disconnect happening? Is it happening purely with the brain itself, or is it where that information is coming in? And again, the answer is really both. And this term neuroplasticity really talks about how the brain is able to change based on the information coming in. So this book by Dr. Norman Lloyd, he really explains this concept. They used to think that the brain was static, that if you had a brain injury, that whatever part of the brain that controlled that function, that function would be lost. But what they found is that the brain will recruit other areas based on the information coming in. So, if you have take, for instance, learning a new activity such as golf or riding a bike, learning to walk, all this information comes in, it creates a pathway. And if that pathway changes, if you start, just say you lost a leg and you start walking on one leg, that's going to alter the information going into the brain and change output as well. Neuroplasticity can be broken down like this. You have a thought, feeling, or action that creates new neural structures, and the repetition of that activity strengthens those connections and creates new pathways. So the brain, we know, can rewire, readjust, and also learn things over again. Disafferentation is a big word for an imbalance of sensory information going into the brain. So that information going in through the different sensory organs. Dis means not right, dysfunction, and afferentation is referring to that side of the nervous system where information goes up to the brain. So basically it represents an imbalance of that information, and that proprioceptive system has 2 sides. It has the mechanoreceptors, which register touch, pressure, textures, that sort of thing. They let the body know where it is in space so that your coordination is proper. Nociceptors register harmful stimuli such as touching a hot stove or other harmful situations. And disafferentation is the process where there's decreased mechanoreception, which is good, healthy information, which actually helps feed the brain and lead to normal neurodevelopment, and an increase in nociception, which is actually harmful and causes this negative neuroplastic situation with negative pathways. It causes an increased stress response and also increased disease susceptibility and global effects other ways as well. So the quality of our lives depends upon that information we take in, but also on our ability to respond in a healthy manner. So we're back to where's that disconnect. It takes a village to really help children that are having these sorts of challenges. I'm certainly not suggesting that chiropractic can cure autism or it's the only thing that needs to be addressed. You need to have speech pathologists, occupational therapists, medical doctors all on your team. However, it is a piece of the puzzle that is not being addressed by society at large. And this study looked at how subluxation creates neuroplastic changes which are functional. Okay, functional meaning they're reversible, and it alters that information going into the brain. So what is subluxation? Vertebral subluxation is a misalignment of a bone basically in the spine that impacts the nerve function. When there's a decrease in the range of motion of a spinal joint, as this study shows, it creates that disafferentation process, which causes that decrease in that good information going up and an increase of bad information going in, which creates central sensitization or a negative neuroplastic process, creating bad pathways. And this study also supported those findings, and again, it found that these changes, these pathological processes are functional, meaning they can be reversed. Dyskinesis is a big word for basically errors in how your body uses energy. It's a state where there's misdirected neurophysiological reactions as well. And this paper looked at how dyskinesis is, it's a reversible process. The scan on the right there, that graphic is showing a segmental EMG scan, which we use in the office. It's looking at how the muscles of the spine, or the muscles along the spine, are working or firing. And that graph there shows that there's quite a bit of imbalance. The red indicates high level of stress, and it's just there's not a lot of balance, and it should be balanced along the spine there. Dysautonomia is a malfunction of the autonomic system, that automatic system that controls all of our function. And so subluxation causes this process where there's dysautonomia, where that autonomic system is not working as well as it should. And we measure that through paraspinal thermography, looking at the skin temperature along the spine. We see on that graphic on the right that scan is extremely imbalanced. All the heat is coming off on the right side, and it's especially imbalance in the upper cervical spine there. And what we know is that the degree of asymmetry, the degree of imbalance, is a good indicator of the degree of dysfunction. And these temperature changes are associated with vertebral subluxation. Fight or flight is that response of the nervous system, which is a healthy response when there's something stressful, such as a tiger or a dangerous situation. The nervous system kicks in and produces a increase in blood pressure, heart rate, all these things that would help us fight or run away. The majority of the sympathetic nervous system is housed in the cervical spine, the neck here. And so it makes sense that when there's a misalignment of vertebrae in this neck where all these nerves are coming out, that would negatively impact the function of the nervous system, just as if you decrease the amount of electricity going to your house, that would cause problems as well. And this study looked at the sympathetic nervous system and how adjusting the spine, restoring the range of motion of the spine, actually produce relaxation in that nervous system, and that especially that fight or flight response area. So how common is subluxation? It's extremely common, which is why I recommend all children get checked at birth, whether they're having problems or not. I've checked my son since he was born. I continue to check him on a regular basis. Not, if he's not out of alignment, he certainly wouldn't be adjusted. But I check him because just how vital the nervous system is to our overall health and function. And so this study found that in the first month of life, 80% of that 1,000 infants that were checked were found to have vertebral misalignments in their upper neck. This study, looking at 1,250 infants, found that in the first 5 days, 90% had suffered birth trauma to the head and neck areas. And this is really why we're having more and more interventions and between cesarean sections and rushed labors and deliveries. The techniques in Western culture are they're not as natural and normal as they used to be. But even in the most natural and normal births, that process is extremely stressful on the spine and nervous system. And as this medical doctor points out, those traumas frequently escape diagnosis. And it makes sense because the infants can't tell us, if there's a problem. And typically these problems, are manifested in things such as colic, failure to thrive, various other issues, ear infections, things like this, and trouble breastfeeding, these different things, and typically goes undiagnosed. So what causes subluxation? Basically, it's all caused by stress. Physical stress we just mentioned in the birth process, but also falls, those sorts of things. Chemical stress, in the mental stress. Chemical stress would be in the form of toxins in our environment, in the foods we eat, and other ways that it could potentially enter our body. So here we are back at where we started. We're here at the scan of a 3-year-old diagnosed with autism. Initially came to my office with the mother had complaints of just wasn't able to follow any sort of requests. He was constantly flapping his hands. He had that stimming behavior, outbursts, very little eye contact, and just a lot of rocking back and forth. And so that scan, the first scan is below, and his second follow-up scan 2 months later is above, and it shows just a tremendous change in the autonomic system balance there. So initial scan showed a high degree of tension, stress, and then the follow-up scan shows mostly white and green there. And but how did that affect his quality of life? This child went from only using one-word sentences to going to 3 to 4 words at a time. His eye movements and his just ability to engage others with eye contact improved dramatically. His coordination, his behavior, a lot of the stimming behavior ceased, and so the scan looks phenomenal, but the results, the quality of life improvement is what really matters. And this is what we use also to track those quality of life improvements. It's the Autism Treatment Evaluation Checklist, which is filled out by parents on their first initial visit or consultation, and on monthly follow-ups, which we also do the scans as well. And what it showed over 2-month period on average, individuals have had a 30-point drop in their ATEC scores, which the lower scores, the better. And the biggest improvements have been in the areas of communication, language, sociability, and behavior. So we're seeing some really great changes there. So now that you know this information, how are you going to use it to improve the quality of your child's life, or even the quality of your own? I know families with a child who's diagnosed with autism are under extreme amounts of stress, both the parents and the siblings, and so chiropractic is a way to help improve, again, not to treat any of those conditions, even autism, but to improve the function of the nervous system, which in turn improves the quality of life, and often quite dramatically for children diagnosed with autism. I hope that you'll give us a call to schedule an initial visit, or if you'd like to speak with me personally on the phone to discuss your child's history and to see how chiropractic can improve their quality of life. I'd love to do so. If you live outside the area or outside of the state and country, I have a wide network of chiropractors that deal specifically with children that I can refer you to, and we'd be happy to do so. I thank you for your time, and I look forward to your call. Take care. Bye.